Cases of malaria have been reported this summer in Texas and in Florida, and that's the first time the disease has spread locally in 20 years. Our Jillian Brooks on your side talking to health professionals about the chances of the disease spreading into our state. Jillian?
Claire, malaria is a parasite spread by mosquitoes causing flu-like symptoms, and it can even be fatal. Now, normally cases we see in the United States are from when someone travels, but recently cases have been spreading through those mosquitoes. However, health officials say it's rare and unlikely that we will see the outbreak make its way to Alabama.
Wesley Williford is the medical director of disease control for the Jefferson County Department of Health. He says malaria has not been commonly spread within the United States since 1949.
Now, we do have sporadic cases of malaria that come into the country. Most of those occur in people who've traveled outside of the country.
In order for the disease to spread locally, the malaria parasite has to be in a large enough proportion of the population so that mosquitoes are able to pick it back up and spread it.
Usually, malaria can't be transmitted unless you have a mosquito involved.
Williford says because the case amount is small and that mosquitoes usually only travel a mile in total from where they are born, he doesn't see the disease becoming a major issue in our area.
The only way that you're going to get malaria established in an area is you have a person who is with an infection who goes in, and then a mosquito is feeding on them and then subsequently feeding on other people.
If you are planning a trip outside of the country soon, Williford recommends heading online to see if that country has any specific medical advice.
If you're going to be going to one of those places that has active circulating malaria, it is important that you try to obtain some medications that are meant to prevent you from picking up malaria.
Now, you can access that country-specific medical advice that you just saw there at cdc.gov. Claire?